and stop on by. Chris?
All right, Nicole, thanks a lot. Well, you know, it's a diagnosis that's kind of hard to pin down, but if you suspect you may have thyroid disease, well, now may be the time to take action. January is National Thyroid Awareness Month, and 2 doctors are offering free screenings for those of you who think you may be experiencing symptoms. Please welcome Drs. Todd Huntley and Edward Kroviak. Thanks so much for being here this morning. And I love that you brought a visual. That's the best part of all.
We did.
Let's talk about thyroid disease in general. What are the symptoms? What should we be looking for?
There are a variety of different symptoms that people could have. The thyroid gland is this walnut-sized gland in the bottom of the neck sitting over the trachea. And it's a very highly metabolically active gland. It makes a hormone that circulates through the body that is the gasoline that runs the body. Some people can have too low thyroid hormone output, sort of run down and tired and hypothyroid. There are some patients whose thyroids are overactive, nervous, palpitations, hypertension. A lot of patients whom we see in our practice are people who have lumps or bumps, masses in the thyroid that we work up for removal.
Okay, so screening obviously a very important part of diagnosing this. So tell me a little bit about the free screenings that you're providing.
The screenings we're providing are really about doing ultrasounds to look for any nodules or masses in the thyroid. There's a blood test to look for people who are over or underactive, which we can do if the patient has symptoms. But we're doing thyroid screenings with an ultrasound to look for any masses that might need to be biopsied or otherwise worked up further.
Okay, and then once you make a diagnosis, tell me about the range of treatment. I mean, I take medication for a thyroid condition. It's something as simple as that to a surgical procedure, correct?
If the gland is over or underactive, there are medications that can control it. And it is the function problems with the gland, the hormone secretions. Like most thyroid problems are more common in women than in men, and usually easily corrected. If there is a lump or a bump in the gland, which is more common than what people may think, the workup could include a very easy little biopsy, and the majority of these are not cancers. And the majority can be watched and not removed. If there is a fear of cancer, the gland can be removed, or a portion of the gland can be removed with a fairly easy surgery. Yeah,
you say fairly easy. I'm glad you said it, but we're showing some video of this. But what you're saying is not so invasive. People are concerned that there may be a scar left. And tell me a little bit about how you guys can do this so that you really can't tell that you've had the surgery, correct?
Sure. We, Todd and I have actually been the first people in the state to perform robotic surgery that actually goes through the armpit. We make an incision behind the muscle underneath the arm so it's hidden, and actually use the Da Vinci robot, which you're seeing the footage of. We control the robot. We do the same procedure once we get to the gland, but it's a matter of putting the incision in a different place so there's nothing in the neck at all to see. Primarily, we think women are interested in this. Men tend to be less concerned about any incisions on the neck. Certainly, if we do surgery through the neck, it's a very thin line. We don't leave a big, heavy scar. But for some people, even that's something that they would like to avoid.
Okay, that's very fascinating and good for people to know. But the main thing is get the screenings done first. Sure. That's the most important thing if you even think that this might be a problem for you.
Yes, thyroid cancer is on the rise, significantly so. Most lumps and bumps in the gland are not cancer, though. A simple screening, simple workup can allay most people's fears.
Okay, Drs. Todd Huntley and Edward Kroviak, thanks so much for being here. Thanks for the information.
Thank you.
And thanks for the visual. I always love a good visual. All right, here's Dave Calabro now with Operation Football.
Hey, good morning, everybody. I'm Dave Calabro, Operation Basketball.